I feel like this planet is a gift, and we're surrounded by so much beauty. And we have this position where we can destroy it or we can take care of it. And it turns out when we take care of it, all of life flourishes. When I was growing up, the poster child for climate change was the polar bear on the iceberg. That was what we thought of. We thought about animals that were far away and things that were changing, glaciers that were melting. But more and more, the exposures that we're seeing resulting from climate change are things that we've been seeing a ton of almost every day. Exposure to severe extreme heat, more wildfires. We cannot just stop breathing the air or stop drinking the water, right? But we know certain people are more vulnerable, like the very young, the very old, people who have any chronic underlying medical condition. I see these impacts of climate change on health nearly every day that I work in an emergency room. Our healthcare systems are dealing with climate change, I would say, on all fronts. There's been really good research which has shown anytime temperatures get above a certain average that we start seeing increases in morbidity as well as mortality. My name is Cecilia Sorensen. I'm an emergency medicine physician, and I'm a climate doctor. Climate doctor is a new breed of medical professional who focuses their work on understanding the complex links between climate change and the health of the patients that they take care of and the communities that they look after.
My wife she's a force of nature in a good way. She's a talented and intelligent leader in her field. She's a great partner in life. She's my adventure buddy. And that spirit of adventure is very much reflected in her professional endeavors.
I'm an associate professor of environmental health sciences at the Mailman School of Public Health at Columbia University in New York City. I also direct the global consortium on climate and health education, basically over 300 health professional training schools in over 60 countries, where at the level of the dean or head of school, they've pledged to train their students in climate and health. Thank you all so much for being here today. We look at North America and we're seeing, the darker the circle is, the more evidence or certainty we have that these impacts are happening and they're truly. Bringing health into the climate conversation is relatively new. Doctors aren't trained, and nurses aren't trained to think about environmental health. I think the result is that we're not necessarily diagnosing climate and health related issues as well as we could. And when we're not identifying that our patient's health is being impacted by this, we're not necessarily providing the right treatment.
Interactive workshops are really critical to training this generation of providers to effectively provide care in our changing climate. We're able to draw connections in real time and see climate change and health in practice in these types of workshops.
I think of workshops like these as being most important for the patient at the end of the day. They are going to make healthcare professionals, the nurses and the social workers treat patients better and understand their context better. And that's going to allow me to be a better caregiver to patients at the end of the day.
We're here in the Columbia Medical School Sim Center. Sim centers are used around the country and around the world to train medical students, nurses, physicians even, in understanding cases that they are likely going to be seeing in their medical practice. It's been really, really hot outside. We've been seeing a lot of cases of heat stroke. Do you guys think this could be heat stroke?
Yeah, it's a good idea. It's something that we had thought about.
Between the years 2000 and 2016, over 125 million people were exposed to heat waves. Heat-related illness is a spectrum of illness. On the severe end of the spectrum is what we call heat stroke, and we diagnose it based on an elevated body temperature and neurologic dysfunction. Some of the work that we've been doing is to recognize that this is a very time-sensitive condition and to develop protocols so that when someone comes in and is diagnosed with heat stroke, a cascade of things start happening to immediately begin to cool people. It's one way that health systems can become more resilient and become adapted to these types of changing climatic conditions that we're seeing. I think the biggest challenges we're facing are around transforming the health sector to be more in line with the climate realities that we're dealing with. We're seeing more drought and we're seeing repeated exposure to wildfire smoke. Wildfires are a natural phenomenon. They've always happened and they will continue to happen, but they're getting worse because of climate change. And as we experienced recently in New York City, there were wildfires in Canada, and we had the worst air quality day in the world.
By early afternoon, the sky was really, really dark orange. It stung my eyes. It made me cough a lot. The air quality was just horrible.
The health impacts from breathing in wildfire smoke can be as much as 10 times worse than breathing in simple tailpipe exhaust. How do we equip health systems to be able to deal with this? It's very difficult, but it's something that we can and need to address. Climate change and our health are intrinsically linked because climate change affects the air we breathe, the water we drink, the soil we grow our food in. We are only as healthy as our planet is. We as health professionals, we are really the first and last line of defense for our patients, for our communities, when it comes to the health impacts of climate change.